Hello, I'm your host, Therese Sucher, Tower Health Executive Vice President and Chief Operating Officer. Thank you for joining me for our 7th COVID-19 podcast. Today, I'm joined by Dr. Suzanne Wenderoth, Executive Vice President and CEO of Physician Enterprise of Tower Health and Interim Chief Medical Officer for Tower Health, and Dr. Debra Powell, Chief Division of Infectious Disease and Medical Director of Infection Prevention. You've both been instrumental in Tower Health's COVID-19 response, as well as educating our employees and the community about the virus and the vaccines. Today, we're here to discuss the COVID-19 booster shots.
Thanks very much for having us, Therese.
We appreciate the opportunity to discuss this important topic.
Great. At the time of this recording, we've been administering the COVID vaccine to adults for nearly a year. Dr. Powell, can you please share what we currently know about how long the COVID vaccine lasts? When might antibody levels begin to drop?
This information is currently being studied. We have some initial studies that demonstrate that the antibodies last for at least 6 to 9 months. Your immune system is complex. It consists of B cells that make antibodies, T cells that fight off infection through a cellular response, and cells and compounds that help your immune system do these complicated tasks. Once your immune system sees a foreign organism, it also produces memory B and T cells that last for years to decades. Some scientific publications looking at other viruses show that patients with SARS, which is a coronavirus similar to COVID-19 but not the exact virus, has memory T cells 17 years after infection. We've also seen that patients that experienced the 1918 flu pandemic had some immunity 90 years later. So the efficacy of this vaccine will depend on the COVID variants that develop as the pandemic continues.
Thank you. The CDC has recommended COVID booster shots for certain patient populations to help maintain protection from the COVID-19 virus. Dr. Wenderoth, can you tell us who is recommended to receive the COVID boosters and when are they eligible to get them?
Yeah, Therese, sure. So as a reminder, a booster shot is recommended due to concern that the effectiveness of a vaccine would decrease over time. And we get boosters for a number of vaccines over the course of our lives. And so that concept isn't new. And actually this month, the Centers for Disease Control, they have an advisory committee on immunization practices, and they just expanded the recommendation for booster to include all adults over 18. And that's for folks who had either mRNA vaccines, so either the Pfizer or the Moderna vaccine, at least 6 months after their second dose. And it also applies to people who had received the Janssen or Johnson & Johnson vaccine at least 2 months prior.
Thank you. Now that COVID booster shots are being recommended, does this mean that the vaccine is no longer protecting individuals? Can you clarify this for our listeners, Dr. Powell?
I'd be happy to. This vaccine is still working. Remember that in addition to the antibodies, you have memory B and T cells that can respond quickly when they encounter COVID, either as an infection or an additional vaccine. Boosters provide an amplified response to the foreign organism with higher and higher levels of antibodies on repeat exposure. Some patients will have breakthrough infections as these antibody levels decrease. The great majority of these infections are mild due to protection from the vaccine. The initial efficacy for the Pfizer vaccine after 2 doses was 95%, and this decreased over 6 months to approximately 84%, but it had 97% coverage against severe disease. So we're seeing similar efficacy to the Delta variant of 88% against symptomatic disease and 96% against hospitalization. So with the booster, the Pfizer vaccine again increases the efficacy to 95%. And the good news is that these current vaccines protect you against the Delta variant.
Thanks, Dr. Powell. That's helpful information. Can you both elaborate on what the research is showing about the booster shots? Are they safe and effective? Dr. Wenderoth, we'll start with you.
Thanks, Therese. So remember, the booster is really just an extension of the COVID-19 vaccines, right? So these were studied and evaluated in tens of thousands of participants in clinical trials before the Food and Drug Administration could approve them, right? Because they're reviewed for safety, effectiveness, and manufacturing quality. So over 442 million doses of COVID-19 vaccine have been administered in the United States, and the safety and efficacy have been evaluated. And some are even saying that the safety monitoring systems that have been put in place after this COVID-19 vaccine and booster rollout are some of the safest monitoring programs that have ever been created. And actually anyone, not just a physician, but a patient or a nurse, anyone could enter information about an adverse event that they've experienced after receiving either the vaccine or the booster through the vaccine adverse event reporting system. So very appropriate types of monitoring in place. In terms of the safety with respect to medical conditions, there are really three to talk about. The first involves anaphylaxis. So a very small number of people have had severe allergic reactions after vaccination. And this actually can happen with any vaccine. And it's part of the reason that when you get the COVID-19 vaccine or the booster, you're asked to stay and be monitored for 15 minutes or so to observe to make sure you don't have one of these reactions. The second safety adverse event worth commenting on is applicable really only to the Janssen or Johnson & Johnson vaccine. And that's an increased risk, although very rare, in fact, only about 7 cases per million, for an increased risk of a blood clot that comes with low platelets. This happens again only in the J&J vaccine and for women younger than age 50. And so folks who might be at increased risk for blood clot might avoid that vaccine type. And then the third vaccine safety item to comment on is the cases of inflammation in the heart. So myocarditis and pericarditis in adolescents and young adults. These cases really have only been reported after getting the second dose of the messenger RNA COVID-19 vaccines. So either the Pfizer or the Moderna. But what's interesting about these safety reports is that first, they're incredibly rare. And second, that it turns out that the benefits of the COVID-19 vaccine actually outweigh these potential risks. So that's what I would say with respect to safety. Now, with respect to effectiveness, it's important to realize that messenger RNA vaccines have really offered a lot of protection. Some would say over 90% protection against severe illness once individuals are fully vaccinated. And it's important to note that this information is true both in our clinical trials, but also based on what we can observe in real life situations. So it's not just what happens in the laboratory. So really these vaccines are some of the most effective that have really ever been studied. The one comment I might add to that is that it does take 2 weeks for your body to build protection after the vaccine. So you're really fully vaccinated or fully protected 2 weeks after your second dose. So in that window, the vaccine is still becoming effective. So you need to follow precautions like masking and so forth. Of course, there are some folks who are severely or moderately immunocompromised. And for them, they have a different lower level of immunity. And we would encourage them to continue to take precautions as though they were unvaccinated. So they might have lower effectiveness than others. But I'll pass it off to Dr. Powell for her thoughts.
Yeah, thank you, Dr. Wenderoth, for going through all the kind of rare side effects, but the primary side effects we see with these vaccines are very mild and similar to the first 2 doses, with the most side effects being injection site pain, which is the predominant, about 70% or more of people who receive the vaccine, and less, about 5% had malaise or just kind of feeling run down, headache, and some joint and muscle pains. So these vaccines are highly effective. And as you stated, probably some of the best vaccines we've ever had, with 95% efficacy. And with the boosters, we're seeing neutralizing antibody titers increasing at least 4 to 20-fold if you get the same vaccine. And by boosting the J&J vaccine, going from 70% to 94%. So highly effective and very safe.
Thank you both. That's very reassuring information. COVID vaccines are available for adults from 3 different manufacturers, as we've heard: Pfizer, Moderna, and Johnson & Johnson. Dr. Wenderoth, are all these 3 vaccines approved by the FDA and CDC for booster doses?
Yes, Therese, they are. They're all the same formulation as the current COVID-19 vaccine. The one exception is the Moderna version of the vaccine is just about half the dose as a booster. So it's important for people to remember when they go to a local pharmacy to get their booster and they share their card with the individual delivering it, to let them know that it's a booster because it's a slightly different dose.
Thank you. When an individual is considering a booster shot, are they required to get the vaccine from the same manufacturer?
No, actually, they're not. And there's a new approach and recommendation, and maybe Dr. Powell can talk a little more about this too, called the mix and match model, which is saying that if you've received 1 or 2 primary vaccines from a manufacturer, you might get even enhanced immunity if your booster is from a different manufacturer. So you're able to request this. If you go to your pharmacy and you say, I've had 2 doses in my principal vaccine from Pfizer, I would like to request my booster come from Johnson & Johnson or Moderna, you're able to do that through the pharmacy. And Dr. Powell, you may have something to elaborate on there.
Oh, thank you. Yeah, there are benefits to receiving a different vaccine. There was a recent NIH mix and match vaccine phase 2 study that was in preprint that was performed in 10 academic medical centers across the country. And those that received the J&J vaccine followed by an mRNA vaccine had substantially higher antibody levels, between 35 and 75 times, compared to a second dose of the J&J vaccine, which increased the levels 4 times. So the current recommendation is obtain a booster, and depending on what's available at your local pharmacy, you can obtain a different vaccine if you wish.
Thank you. I've had family and friends ask me why they should get the booster dose. I'm sure the 2 of you have received the same question from your colleagues and your patients. Can you both share why individuals should get the booster? And what would you say to encourage your healthcare colleagues to consider when deciding if they should receive the COVID booster shot? Dr. Powell, we'll start with you.
Yes, I have received this question also, and I'm recommending for everyone over 18 to get the booster dose. And again, 6 months after the primary series, if they're not immunocompromised, and 2 months after if they receive the mRNA vaccine, if they are immunocompromised. Again, it's to increase your antibody level to give you extra protection. And this is going to be important as we get into the holiday season and through the winter months to protect you and the people around you.
Thanks. Dr. Wenderoth, is there anything that you'd like to add?
Yeah. So remember, COVID-19 vaccination booster can reduce the spread of disease overall, right? Protecting all the people around you in our society. The messenger RNA COVID-19 vaccine has been shown to reduce the risk for very severe illness and hospitalization among all ages, even for folks who receive a COVID infection after they've been vaccinated. These are called breakthrough cases. So this is really a very powerful tool.
Thank you. I'd like to remind our listeners that some of our Tower Health Medical Group practices may be offering the COVID shot and the COVID booster shot for existing patients. but we also encourage community members to explore options for receiving the vaccine from other sources, including local pharmacies and community clinics. You can find a vaccine distribution site by searching vaccines.gov or texting a home zip code to 438-829, or also by calling 1-800-232-0233. Please remember, if you receive your COVID-19 vaccination, we encourage you to share your COVID vaccine record card with your provider at your next appointment so that the information can be added to your medical record. I appreciate both of you taking time to provide this information. Is there any additional information you'd like to share with our listeners? Dr. Wenderoth, we'll start with you.
Thanks, Therese. I think what I would say is that we need to talk to our friends and neighbors about what we know about the COVID booster, about how safe it is, how effective it is. And when folks are concerned or nervous, we have to help them really address those issues and guide them by providing some resources through the Centers for Disease Control or the Department of Health. A lot of times, because these vaccines are new, people are nervous and they've heard stories, but the facts are growing that it is truly safe, and the boosters are also safe. So we're seeing cases of COVID on the rise, and getting a booster now ought to be able to protect us from any future breakthroughs. So that's what I would say.
Thanks. Dr. Powell, I'll give you the last word.
And yes, thank you. The vaccine is the best option for society as a whole to achieve high levels of protection with minimal side effects. This vaccine saves lives. The vaccine protects you by lowering your chance of becoming infected and spreading disease to others. If you get infected, it decreases the chance of you becoming severely sick and requiring hospitalization. The vaccine and the booster protects you and those around you, including your family and loved ones, our patients, and our community. We're very fortunate to have highly effective vaccines that are available for both adults and now for children ages 5 to 18.
Thank you both. As a reminder, the COVID-19 vaccine is another important tool to help mitigate the pandemic. We are still seeing cases of COVID-19 in our communities. Vaccination reduces the spread of the virus, along with wearing a mask, social distancing, and hand hygiene as recommended by the CDC. As always, we at Tower Health appreciate the efforts of our community members to help us stop the spread. Thank you. Be well and be vaccinated.